After studying this module, you will be able to know about the meaning and significance of drug administration, the modes and methods of drug administration in the body, and the prominent routes of drug administration. Drug action is a relative event that depends not only on the intoxicating properties of the chemical and the dose administered, but also on specific and interspecific variation in the metabolic processing of the chemical. The principal appreciation of the association between the dose of a compound and the response produced has been credited to Paracelsus. Drugs need not every time be administered orally, that is by swallowing, but may also be given parenterally. These routes generally talk about an injection, although enteral absorption is also circumvented when drugs are inhaled or applied to the skin. For intravenous, intramuscular or subcutaneous injections, drugs are often given as solutions and less frequently in crystalline suspension for intramuscular, subcutaneous or intra-articular injection. An injectable solution must be free of infectious agents, pyrogens or suspended matter. It should have the same osmotic pressure and pH as body fluids in order to avoid tissue damage at the site of injection. Solutions for injection are preserved in airtight glass or plastic sealed containers. From ampoules for multiple or single use, the solution is aspirated by the use of a needle into a syringe. The cartridge ampoule is fitted into a special injector that enables its contents to be emptied by the use of a needle. An infusion talks about a solution being administered over a protracted period of time. Solutions for infusion essentially come across the same standards as solutions for injection. Drugs can be sprayed in the form of aerosol directly on the mucosal surfaces of body cavities accessible from the outside. Example, the respiratory tract. An aerosol is a dispersion of liquid or solid particles in a gas, such as air. Aerosol fallouts when a drug solution or micronized powder is concentrated to a spray on being compelled through the nozzle of a pressurized container. Mucosal application of drug by the rectal or vaginal route is accomplished by means of medicines and vaginal tablets respectively. On rectal application, absorption into the general circulation may be anticipated. With vaginal tablets, the effect is mostly limited to the place of application. Generally, the drug is incorporated into a fat that solidifies at room temperature but melts in the rectum or vagina. The resultant oily film spreads over the mucosa and facilitates the drug to pass into the mucosa. Ointments, powders and pastes are applied to the skin surface. In many cases, these do not contain drugs but are used for skin protection or care. However, drugs may be added if a relevant action on the outer skin or more hardly a systemic effect is anticipated. Transdermal drug delivery systems are pasted to the epidermis. They contain a reservoir from which drugs may diffuse and be absorbed through the skin. They offer the benefit that a drug accumulation is involved non-invasively to the body, facilitating the drug to be administered in a fashion similar to an infusion. Drugs amenable to this type of delivery must be capable of penetrating the cutaneous barrier, be effective in very small doses and possess a wide therapeutic margin. Next is different routes of drug administration. Routes of administration can be categorized based on where the target of action is. According to the action of drug, the following are the two main routes of its administration. First is enteral routes. Those routes in which the drug is administered by way of gastrointestinal tract are termed as enteral routes. It at times referred to as enteric administration also. Enteral administration typically consists of oral and rectal administration of drugs. Sublingual and sublabial are also considered to be enteric routes of drug administration and are generally covered under the oral category. The gastrointestinal tract provides a comparatively safe but relatively slow acting site for drug absorption. Many drugs as capsules, tablets or drops are taken orally. Administration techniques directly into the stomach contain those by gastric feeding tube or gastrostomy. Similar to the duodenal feeding tube and enteral nutrition, substances may also be positioned into the small intestines. Some enteric coated tablets will not dissolve in stomach, but it is directed to the intestine because the drug present in the enteric coated tablet causes irritation in the stomach. First is oral or mouth. In this route of administration, the drug is kept in the buccal cavity where it disintegrates and absorption occurs in the mouth. When it is placed below the tongue, it disintegrates there and then absorption takes place in the mouth. The pH of buccal cavity and mouth ranges from 4 to 5. The tongue and the gums are the most absorptive area in the mouth and can be considered as a route of drug intake. The top surface of the tongue is referred to as the supralingual, and while the bottom surface of the tongue is known as the sublingual. The absorption through sublingual is fast as it transforms the drug or poison directly through the route of heart, although this might take some time, but still it is a better method of passing the drug directly to blood through the heart. Second is rectal. Some drugs can be made into suppositories and are inserted into the anus where they are absorbed into the bloodstream directly through the mucous membranes. The mucous membranes are very fragile, and administration of very acidic or very alkaline drugs tend to burn the tissue, causing damage. Since these are internal membranes, it's often difficult to assess how much damage has been caused unless there are obvious signs such as rectal bleeding. The rectal route is an effective route of administration for several suppositories, especially those used at the end of life. The walls of the rectum absorb several medicines rapidly and efficiently. Drugs provided to the distal 1/3 of the rectum at least moderately avoid the first pass effect through the liver, which tolerates for greater bioavailability of several drugs than that of the oral route. Rectal mucosa is highly vascularized tissue that allows for rapid and effective absorption of medications. In hospital attention, a specialized rectal catheter designed to offer comfortable and modest administration of ongoing drug administration provides a useful approach to deliver and retain liquid formulations in the distal rectum, giving health practitioners a way to leverage the established benefits of rectal administration. Use of speed and ecstasy this way is very popular. Many drugs that are administered orally can also be administered rectally as a suppository. In this form, a drug is mixed with a waxy substance that dissolves or liquefies after it is inserted into the rectum. The drug is readily absorbed in the rectum's wall as it is thin and with rich blood supply. A medicine is prescribed for people who are unable to take a drug orally because they have nausea or they cannot swallow, or they have restraints on eating, as is required after many surgical operations. The rectal route of administration has the extra advantage, like the sublingual route of administration, of preventing the destruction of the drug by intestinal enzymes or by low pH in the stomach. The rectal route is also advantageous if the drug induces vomiting when administered orally. If the patient is already vomiting or if the patient is comatose, on the other hand, rectal absorption is time and again unpredictable and imperfect, and many drugs aggravate the rectal mucosa. Second is parenteral routes. The term parenteral is understood when the drugs are administered by a route other than the enteral routes. That is, the drugs are delivered without the involvement of gastrointestinal tract. Parenteral dosage forms are proposed for administration as an injection or infusion. Common injection types are intravenous, subcutaneous and intramuscular. Infusions typically are given by intravenous routes. The anticipated effect of this type of administration is systemic. The parenteral route leads drug straight across the body's barrier defenses into the systemic circulation or other vascular tissue. Parenteral administration is used for drugs which are poorly absorbed from the gastrointestinal tract and for agents that are unstable in the gastrointestinal tract. Parenteral administration is also used for treatment of insentiment patients and under conditions that call for a speedy inception of action. Parenteral administration includes the following ways for the administration of drugs. First is subcutaneous. In this route of administration, the drug is given into the subcutaneous layer with the help of injection. Drug once reaches to the subcutaneous layer, crosses the membrane and absorbs into the blood. In case of subcutaneous administration, a needle is inserted into fatty tissue just beneath the skin. After a drug is injected, it then moves into small blood vessels, that is capillaries, and is carried away by the bloodstream. Otherwise, a drug spreads in the bloodstream through the lymphatic vessels. The subcutaneous route is a preferred route for many protein drugs for the reason that such drugs would be destroyed in the digestive tract if they were taken orally. Second is intradermal. This term is related with the administration of drugs intradermally through the surface of the skin. This type of route of administration is found in cases of chronic poisoning or some kind of idiosyncrasy caused by the use of certain contraceptives which are now available for transdermal usage also. The release of drug by this kind of administration from the reservoir of drug is quite slow. Third is intravenous. Intravenous therapy is the infusion of liquid substances straight into a vein. Intravenous basically means within the vein. Treatments managed intravenously are generally known as specialty drugs. Intravenous treatment may be used to correct electrolyte imbalances, to provide drugs for blood transfusion, or as fluid replacement to correct, for example, dehydration. Intravenous treatment can also be used for chemotherapy. This is one of the fastest way of administration of poison or drugs into the body because the injection is directly given into the veins, providing a direct route to the drug to get into the blood and thus circulate throughout the body very quickly and showing the resulting symptoms almost instantaneously, leading to severe condition of the victim and mostly leads to immediate death of an individual. The drugs administered through this route have essentially 100% bioavailability. Fourth is interosseous. This is related with the infusion of drug in the bone marrow. It is treated as subsidiary intravenous admission as the bone marrow channels directly into the venous system. This route is generally used for drugs and fluids in case of emergency medicine when intravenous access is difficult. Fifth is intra-arterial. It is the route by which drugs are administered directly into an artery. In intra-arterial mode, the drug is administered directly into the artery through injection. In this case, the commencement of action is rapid, similar to that of intravenous administration. Sixth is intramuscular. By means of this method, the drugs are customarily injected into the muscle of the thigh, upper arm or buttock. The volume of time taken by the drug for getting absorbed into the bloodstream depends in part on the blood supply to the muscle. The lesser the blood supply, the longer it takes for the drug to be absorbed. Seventh is inhalation. Nose acts as the chief route of inhalation. The mucous membrane of the nasal aperture is an absorptive surface that principally lines the whole passage of the airways. Mucus is a protective covering which is made up of a mixture of proteoglycans which lubricates the nasal passage and airways and helps to remove the undesirable particles. Those particles which are very small in nature and are in gaseous form and cannot be stopped by this membrane, rather due to the presence of this absorptive surface and the small particle size of drugs, they are absorbed quickly and transported to the lungs. From lungs, they get into the blood and affect the whole body system more or less immediately. We'll conclude this module with the summary. Selection of the appropriate route of administration is important in toxicological analysis and evaluation of the degree of toxicity. In general, as the objective of a toxicology study attempts to mimic human or animal risk exposure, dermal administration is required for estimation of toxicity of chemicals that may be absorbed through the skin, as well as for estimation of skin irritation and photosensitization. Intranasal insulfation is a popular method for therapeutic administration of corticosteroids and sympathomimetic amines and for the illicit use of drugs of abuse such as cocaine and opioids. The dosage form in therapeutic use is generally aerosolized in a metered nasal inhaler. In the case of illicit use, crude drugs are inhaled, that is snorted, through the nares as fine or coarse powders. Dermal injections have the poorest absorption capabilities of the parenteral routes primarily because of limited circulation. Methods of injection include subcutaneous, intravenous, intramuscular and intraperitoneal.